Okay, I'm going on this subject. I haven't used this channel for a while. The 14th of 3rd, 2019, for anybody that doesn't know this. Okay, since 2017, I ended up in hospital with suspected another stroke and a heart attack. An emergency situation, ended up in hospital. Now, if my health hadn't deteriorated by the 3rd of the 10th, 2017, I wouldn't have called the local public sector services known as adult health social care. If I'd known all this time moving on, the national cuts and blocks to accessing goods and services in the NICE National Guidance and Statute Law of the disabled people's rights and lawful choices and outcomes in offer goods and services, whatever your situation may be with your physical, mental health, housing, care needs. And it is true, it's factual, you can download and look at the information and the key clauses of how you're meant to be involved in decision making, how you're meant to be involved and with your consent to any offers or anything like OT assessments. If you're in this housing situation and you don't get the offer repairs and you have, say, a so-called wet room and your landlord refused to repair it, and that comes in line with it too. That's in line with your rights in social housing statute law, the Housing Act. It's a statute, and it's 1989 or 88, section 11 of secure tender, especially if you've been renting over 5 years. And I found out today that it is the duty of care of the National Housing Company employees to offer, if they require me to move out my current location into another 1-bedroom property that does have the access wet room. Well, when I explained I already got a wet room and just won't repair it for 1 year, 9 months, he was shocked. He said, why won't they repair it? Well, I said, I have this case going through they call it the Housing National Ombudsman Service, and that's for 6 months to investigate, because I've gone through the process of stage 1, stage 2, and I've got so many emails. What was confirmed, that I would be offered funding, all of my costs for storage of my belongings would be paid for, and costs of a hotel. And then my private friends who care for me, because of the negligence of what happened to previous same area public sector services individuals in the adult health social care sector, has all changed in their terminology now and where they work. Well, the old system was negligent then, and when you have care companies go bust, they should make sure there's someone to support and replace, and they could have got a temporary, they call it, I don't know, whatever team, whatever town or city you're in England, they might have a different team name for certain temporary carers to come in. Well, anyway, cut long story short, I was never offered that option. And when I had personal injury, and so much has been going on in previous years, and evidence of former offers of occupation therapy reports I've had done 2010 up to 2013. The fact is, if your needs of equipment use of your medical loan, NHS England funded loan medical equipment is not changed, then there is no lawful ground for an update occupation therapy offer of assessment. The only change in my situation is my physical reduction in my health and my right use of my arm. So I'm doing this because I had an email yesterday, and it's deliberate to personal insults and attack my credibility yet again, because I had never been involved in the lawful statutory law Care Act needs assessment at all for the past year. So all these previous emails since, again, 2000 end of last year, 23rd, for example, of November 2018, I never had any response because I wasn't there. That temporary, I meant to have a replacement of a social worker that had left a job in October last year. And leading up to those dates, if that individual knew she's going to leave her job, why would they offer vulnerable on their own, in their own home, with strangers, knowing, in fact, on my medical notes, I can't cope with strangers on my own, let alone an occupational therapy assessment on my own. And they knew full well my private life friends could not take extra time off or be involved in this. And I found out, in a long story cut short, also that this national housing company, individuals living in my area, East United Kingdom, where a certain individual was behind, trying to access my private medical notes. What my disabilities are, it's got nothing to do with that. Just so they can try and use that to get me displaced from my home. So I had found out a lot of evidence and checked my previous emails and found the fact that this female, I won't mention who she is, had already known the fact of evidence, because I conditionally, under duress, sent a copy of a document with help to this former social worker to assist her in the subject, going through this care needs assessment, I thought, on the subject of housing. Because if I was going to be moved in, like, say, a temporary placement, whatever that might be, and then that care home or temporary placement would need an update, OT report before they would consider me there, and what my equipment, you see, that didn't tally in either, because I have update reports of services on my medical equipment, and that's all up to date. And all they could easily do, that former social worker, was to draft up a note or a letter report of this equipment, and I use for 2 carers, and what my needs are, which I went through all during past year and the meetings. And obviously then it came out of the blue to claim by the 31st of the 8th 2018, or you might need a new OT assessment. There was no, I found out by research all this time on to date, there wasn't any evidence to make that referral, and they call it a single point of access. And all that they were doing it for was this housing company employees who had misinformed them. So I tried to seek working with them, engaged, found a local hotel around the corner. Had a level access shower, safe, big enough for me and the medical equipment. And then I sought the local public servants to fund the first 6 weeks free carers. And that way they could see what I can and cannot do. That was an issue for them. And then they could easily assess me on the OT side as well in that location. Well, that deliberately got rejected, and the strong threats in the tones of the emails I got back was deliberate and obvious. It has to be in your home. No, it doesn't. And of the other OT assessment. It all relates to the blocking of the lawful, my right, or anyone's right, to your secure attendance and terms and conditions of right to repair. So then you have a 7 months delay of the National UK Housing Ombudsman to investigate your housing complaint. And then you're left in unsafe housing. So what that leads to is that any time you get an offer of home visits or services by companies, public or private, they raise concerns about the conditions that the disabled individuals living in. And it's not your doing, or no one's doing anything to you, it's deliberately done. That you pay your rent for, and it's not, and they put you in at risk, you know. So I said, well, there's no point doing your referrals or whatever because I'm already in the system, so it's pointless. And therefore, when also what's meant to happen, if I had a bereavement of my late mum last year, there was not one compassion. They took no notice of that, the effects on my psychological well-being, and they made it deliberately worse. So I could not engage. I couldn't even do a 2-hour meeting, and they kept. It was all to do with cuts in public funds. Never ever be bullied into or traumatised or treated unlawfully, discriminated against, which I have and still am. And so therefore the Coventry, United Kingdom based Adult Health Social Care Ombudsman Service has re-investigated and opened my case, and still take another 20 days because I've got a backlog of complaints of other people in my situation. Maybe different, but it's a national scandal. I don't know how I'm going to keep going because my private life friends is just that. And as my health deteriorated, they struggled to care for me. So I haven't been able to access operation I need because I can't recuperate here where the environment's the way it is. And then, as anybody just knows, you're dealing on top with the statutory cutbacks in your disability living allowance, transferring on to the personal independence allowance, the DWP, subject to Department of Works and Pensions schools in the UK, then the universal credit. And then the cutbacks suddenly, oh, there's no response. I've got evidence of emails, by the way. It's called a Care Act Advocate Service. And that individual, she's now left a job, and therefore she's pulled out. Again, this is the third time in a year. Again, I'm waiting and left back to square one. So it is not I that has caused anything negligent. It is the other way round. So these civil servants, especially management role and director role, they are the ones that's covering their behind and blaming the vulnerable disabled people. And that's unlawful discrimination and breach of equality statute law as well. So good job I keep a journal and diary of dates, because I had a gut feeling, why did they offer me an appointment of OT assessment in my home, knowing full well that former social worker was leaving a job and I'd be on my own? And then full well that this Care Act Advocacy Service does not assist vulnerable people in their homes in an occupation therapy assessment process. I did not know that. But then I've since investigated further, and I found, anybody doesn't know this, that NHS England has the Better Healthcare funding budget. And that goes through your GP or district nurse, which I've already inquired about. And that pot of funding is not means tested, as long as if you meet the checklist. And I checked that out, and I do meet quite a few of the points and criteria. And then when I emailed and made inquiries about that, they said, oh, we've already had a social worker, then it's best to stick to them. Whereas the one I thought I had offered to me on the 23rd November 2018, and it's now over 3 months, no response by that individual, I don't. So one is going to go back to that angle to see if one can instead be offered, because if you have a medical condition, which I do, and disability, then you just might be able to get some funding. And then your better choice, because at the moment it's all one-sided, where they're just pushing their agenda in my area for this national housing company to push vulnerable disabled people in expensive care homes and not to be independent living. That's all it's about. So I found this out by an individual, and she is doing a national study of all social workers, well, best ones she can get hold of, and disabled people, if you can access anything to do with community, any quality of life. Well, I said no, because what do they expect disabled people to do? Stay at home and have virtual headsets on, and then stay in bed and not do anything. Well, by her linking up the dots and by other individuals saying past few days and past week, it's basically clear that I've been targeted, because not just me, that those that have high care packages, they are trying to take your equipment away. They cannot lawfully do that. You see, it's an assumption presumption. If an offer of a care OT assessment is not about to aid your life, it's about what aids they can cut from use of to a single carer. But they know full well the environment I live in can't have a ceiling hoist. But you see, it's unlawful. So please check out the National NICE, N-I-C-E, statutory, what your rights are in the care needs assessment in line with the National Duty of Care in the Statute Law Care Act 2014, and please check out the actual framework. If you do have friends and family, and I don't know what your situation is, but if you're an adult working age, they're making it extremely hard to exist independently, and worse off in many areas. So my mate's just drawn up another email to counterclaim back to this certain individual that she's a civil servant, she works for the public, and she just absolutely just been like this since 2017 to me, because it's about prevention. When they hear the word prevention team, it's preventing people accessing adult health social care services where you live. Throughout the United Kingdom, especially in my area, they first started off with the national cutbacks all over the media, February 2018, right throughout to date. And that's why they come on the attack with those who are educated with factual information and send the actual evidence off for them to read for themselves. You might have very good social workers that are trying to do their job, but they're scared to whistleblow and speak out, because their managers, their directors might just come down on them and just they lose their job. But they are part unions, and they got lawyers with their unions, but disabled people can't find community care lawyers. There's no funding to help you find somebody. And if you don't have the family network support around you, they're relying on you to be, they want to push you into submission, so they don't have authority. Be sensible though, don't cut your nose off to spite your face. That's what I'm trying to be careful about. And I know full well that as soon as you get out of this, your secure tender, your home and temporary accommodation, you will not just get back just like that. I've had with experiences before, and if it's more funding cuts are worse now, what do you think it's going to be if that claim to be offered? So I will make do what I've got at the moment. It's still a rocky ride, so to speak, and it's all unlawful, but at least I've got the evidence. I've just come live. And when you have evidence, and medical evidence of that already, and of course I've got diary and dates and times and things of what was said and what was not said and by whom, and you provide the evidence of that. And especially when you use their own statutory complaint system, when they back each other up and block you access to remedy on that area. So there's an email of 16th of 10th 2018 I've got confirming I do not need a Care Act assessment correction. The social worker at the time said I do not need a occupational therapy assessment. She said she can carry on with my Care Act needs assessment without that. And also the former Care Act advocacy individual email claimed I would have been sent a full disclosure advanced questions for that assessment. And then you see when you have that final completion of a Care Act assessment, needs assessment, it goes to a funding panel. And I saw a previous email before clarification or evidence of a policy of the local council to confirm where does it state in their constitution and documentation to prevent me to be referred to the long-term physical disability team. And to date I've had no response on that one. So on that basis, without it was also comments made about on the housing side. For example, there was a comment mentioned about an OT assessment going back 2011, and yet to be aware about this, your privacy, your right to private life and privacy in your own home, especially in a vulnerable position with strangers, if you're getting personal care, and that's like washing and dressing. You don't want strangers to watch people you don't know, and they have got no consent to come in and watch you being washed and dressed. If they're only looking at your transfer and OT needs, then there is no requirement between a certain hours when you need to get those particular needs and care needs sorted out first, and when you're decent and in your wheelchair. But I found an email where they claimed a previous, as I said, social worker had claimed, and obviously that causes alarm bells at the time, and I found that, so that's gone into a document as an amendment into an email and be sent tomorrow in working hours. So God bless, keep safe, be aware. They really don't want you to know what your rights. And by the way, I've got all this previous evidence on manhandling assessments already done. The previous social worker, she didn't even look at the reports. The detailed one and the factual up-to-date one was 2013. The use of medical equipment's not changed, or the way it's used. And again, I repeat, unless that is changed, that's the only clause in National 2019 now that they can offer and imply that that may be required. So as long as your equipment is up to date and service and stuff, they haven't got a lawful ground unless they produce a document or policy where it states that in statute law. God bless. I hope this helps somebody else.